Good evening, students. Today I will be discussing from Gpat questions from 2023. It may be helpful for you because it will give you some ideas about the different type of questions. So, first question I am discussing here: what is the schedule for ophthalmic preparation? That you have studied in the jurisprudence. That is Schedule FF. That Schedule FF contains the regulation and standards for ophthalmic ointments and solution. Next question: in which resin cinnamic and benzoic acid is present? So there will be some options, but you know the answer is the balsams resins. Okay. Next, what type of glass is not used for parenteral preparation? That is IV, NP, general soda lime glass. Generally, regular soda lime glass is not typically used for the parenteral preparation. Soda lime glass has a higher expansion rate and is more prone to thermal stress and breakage when exposed to rapid temperature changes, such as those encountered during sterilization. Therefore, it is not considered suitable for the stringent requirements of the parenteral, that is injectable preparation, where stability and integrity of the container are crucial. What is the family of isabgol? That is Plantagenaceae. Okay, so you should remember about this. Name the schedule for disinfectants. That is Schedule O. Schedule O describes the standard for disinfectant fluids. Next, what is the Lucas test? That is one of the important tests for the identification or differentiate between the primary and secondary and tertiary alcohols. So, I am discussing here the Lucas test is a chemical test used to differentiate between primary, secondary and tertiary alcohol based on the reactivity with the Lucas reagent. The test is named after developer Howard Lucas. The Lucas reagent is a mixture of concentrated hydrochloric acid and anhydrous zinc chloride. The reaction occurs by the displacement of the chloride ion from the Lucas reagent by the alcohol. The rate at which the reaction takes place is dependent on the type of alcohol being tested. What is the weight of the 00 capsules in mg? That is 120 to 160 mg. That's why you should study the different weights of the capsule. Okay, from the pharmaceutics book. Alkaloid strychnine is present in which of the following? That is Nux vomica. There you will get different options from the alkaloid. Why is thermogravimetric analysis useful? So that is determining purity and composition of materials, drying and ignition temperature of materials, and knowing the stability temperature of compounds. Okay. Next, coming to what does Schedule M2 deal with? It deals with cosmetics. Okay. Next, trastuzumab is A or N. Actually, what is this? That is the EGFR HR2 inhibitor. So, trastuzumab, sold under the brand name of Herceptin along with others, is a monoclonal antibody used to treat breast cancer and stomach cancer. What is NDA made? Once the animal studies are done and drug is declared safe in animals, so there are options. So, after clinical 3 trial, the NDA is made. After phase 3 clinical trial, a new drug application is submitted to the licensing authority who if convinced, give marketed permission. Which metabolite is used to inactivate the vesicotoxic metabolite leading to the hemorrhagic cysts by alkylating agent used in the treatment of cancer? Mesna. Okay. Which of the following is 4th generation cephalosporin? That is one of the important cefepime. All are true about the metoclopramide except that is it is a 5-HT1 receptor antagonist, D2 receptor antagonist, 5-HT3 receptor antagonist and 5-HT4 receptor antagonist. That is a 5-HT1 receptor antagonist. I will be discussing 20 questions, and apart from this I will share the PDF and you should study among the pages. Identify the drug that is not among the drug recommended as a first time drug in treatment of partial seizure which or without generalized seizure. Carbamazepine, valproate, diazepam, lamotrigine, diazepam. All of the following are TNF alpha inhibitor except basiloximab. Okay, thank you. Up to this I am completing here, and I will share the different PDFs to you.